Dave Palumbo here with another RXMuscle supplement and science edition. I'm here with my good friend, Dr. Victor Prisk, and I can't believe Victor, I think I know you before you were a doctor. That's how long this goes back.
No, I was in residency already.
Oh no, you are. You're right. Yeah. You're right. You are in residency. Yeah. I like to think I do know. How long have you been a doctor now? How many years?
I graduated med school in 2001.
Wow, 20 years.
I was a practicing physician since 2006, basically.
That's incredible. If you need, if you're in the Pittsburgh area and you need anything fixed, Victor orthopedically will be the man to do it for sure. And you also have this wellness clinic now, which is enormous. I mean, I see all the pictures of it. I mean, that was always the thing I know you really wanted to do that. You had a real passion for that, right?
Yeah, I mean, that's something I've been doing for a really long time. I mean, even when I first started my practice, right out of my training, I did a study looking at how low testosterone levels actually correlated with Achilles tendon ruptures. And I'm probably one of the only docs who's published a study of that nature. So, I mean, it was one of the things that I just always had interest in, and understanding how, you know, anabolism and catabolism kind of affect our recovery of our joints, our tendons, our, you know, muscle reconstruction, that kind of stuff, you know, just everything, healing, paying attention to the whole organism, as I like to say.
What's the number one injury you see in bodybuilders?
Tendon injuries, or arthritis in the older bodybuilders, of course. But tendon injuries are most common, whether it be biceps. Very rarely do you see triceps in anybody other than somebody lifting weights.
But I mean, in bodybuilders, what's the most prevalent? Bicep tears?
I would say quad or patellar tendon is more common than a biceps even.
Yeah. Those are, as I can attest,
it's
not a fun operation. It's not a fun operation to recover from, that's for sure.
And almost every one of them isn't while they're training. It's something else. Stepped on a step funny, you
branch slipped, right? Curve. Yeah. Evan said the funny on the ice, you know.
You lunge at a meter maid. I don't know, something like that. Anyways.
Victor, right? Victor had his crazy one.
Hey, I didn't say nothing. No way. Come on. I love the guy.
Yeah, no, I do too. So today, obviously, you know, with the death of Sean Roden, and I think the death, we can't leave out the death of George Peterson 2 days before the Mr. Olympia competition. I mean, a lot of people are like, you know, I think people are working around scared a little bit. I think people are, and I'm glad they're scared, because they should be scared. You know, we've seen a brash, I don't know, or a huge number of bodybuilding deaths over the last 2 years. I'm pretty quick to point the finger at COVID as being maybe something that sped this up or has something to do with it. Why do you think we're seeing all of a sudden in this day and age, the last 2 years, so many deaths in the bodybuilding world?
Don't forget Jen too, her passing away.
Jen Hernandez, yeah, absolutely.
Oh gosh, that was terrible too.
Yeah.
All this, and it's amazing. I mean, there've been the bigger ones too, you know, like Dallas over the years, and there's always a little conversation that happens around each of these, but it's been so often right now that it's really opening up some awareness. It's, you know, any conversation here is just going to be about the awareness. It's not about the individual, how they died, because we don't always know. We don't know for most of them what caused them to die. If they didn't release the autopsy or coroner's report or whatever, you know, it could be anything from drug overdose to suicide to heart attack, you know, it could be anywhere in between. So I think we can't jump to those conclusions as to the causation of why bodybuilders are dying, but we do know that bodybuilders are dying, and it seems like a good majority of them are related to cardiovascular events. And so yeah, it's a tough problem, and I know both anecdotally as well as in my practice, anecdotally I guess as well, is the number of people who, you know, have cardiovascular problems related to either prolonged use of anabolics and or other aspects of the sport with regards to gear. We have to just be aware. And I think this is a good time to make us aware of what those problems are and what the signs are early on
Yeah.
that we can kind of avoid.
And, and I'm a big advocator, and people know this, and I sound like a broken record sometimes, but you know what? I'm going to keep sounding like that broken record, because if I just keep reaching one more person each time I say it, then I'm doing my job. But you got to get screened. You cannot walk around, and I'm guilty of this. Early in my career, I didn't get tested, but there wasn't a lot of awareness back then like there is today. There wasn't the internet and everyone communicating with each other and talking about these topics. So I kind of blame that, but had I been competing in this day and age, I definitely would be going to get these testing protocols. And there are a lot more available today. You couldn't get a cardiac CT scan to see if you had a blockage in your coronary arteries back in the 90s. They didn't have them, or they weren't available. And nowadays you can do that. And I think that a lot of guys are not taking advantage of the technology we have today and testing these parameters, checking their blood pressure every day with a blood pressure cuff, checking their fasting blood sugars to make sure they're not, pre-diabetic or diabetic, going for blood work, and if their red blood cells count is through the freaking roof, donating a pint of blood. I mean, these are just very easy things that can be checked. Kidney function, creatinine and BUN and stuff like that. Why aren't people taking more advantage of the technology we have? They're taking advantage of the technology in terms of training and supplementation, but they're not taking advantage of the medical technology we have available now.
Yeah, I think there's a couple aspects of that, when it comes to the younger athletes and things. You're an athlete, you're a bodybuilder, you're supposed to be healthy, you're in shape, you're eating the right foods and things. There may not be this feeling that you're unhealthy. And I think we have to open the eyes to the fact that the yo-yo dieting and the bulk phases and the coming on and off of gear, how they affect your whole system. Sometimes it's the coming off that's the worst part for you. So it's something where we have to get the younger people, or even the ones who just think that they're healthy, realize that they need this. And then the second aspect is going to be, the fear of going to the doctor,
right?
The fear of judgment. I talked about this before, where if you're being judged by your own physician and said, "Oh, you got to stop that stuff. You can't be doing this bodybuilding.
You don't want to go. You don't even want to go hear it, right? It's your parents telling you.
You won't want to go. I have more patients that come in and trust their chiropractor over an ND about what to do with their nutrition and their health and their medications and whatever else, because they're just afraid that MD is going to tell them, you know what, you're just crazy. You're a drug user, whatever, get out of my office kind of thing. So we have to find that judgment-free zone, not to steal the Planet Fitness thing. Anyway, so we have to really get the awareness out there that there are doctors like myself that will do these kinds of exams and will even consider doing the virtual visits and things.
Right. I
mean, you can certainly do that with my practice at any time if you want to. So
just take the echocardiogram for instance. If you don't have the right person reading the echocardiogram, a lot of times they could be measuring, your heart incorrectly or your ejection fraction incorrectly. I've seen this happen with a lot of bodybuilders, and I've sent them to cardiologists who have a understanding of bodybuilders and how to measure the heart properly. And the cardiac readings went from an ejection fraction of 20 to 60 just because they weren't being measured correctly. I mean, by whoever was reading the echocardiogram. So it's important that you do go to, I think, see a physician that understands the bodybuilder and how the bodybuilder has different anatomy, essentially, right?
Yeah, certainly there's going to be more cardiac hypertrophy. There's going to be issues with even the hypertrophy of the muscles in your arteries that can cause some renal artery stenosis and things like that. So there are certain things you just have to kind of keep in the back of your mind, that this isn't a healthy person. This is a person who's pushing their body to the limits. And a lot of times, I mean, I'm not saying that being a bodybuilder is not healthy. There are certainly healthy bodybuilders. There are people who do it right. But there are going to be those guys, the less likely ones to go get jacked, that are doing stuff that they shouldn't be doing and don't even realize it. Guys or gals, I mean, it's really become a problem in both places. I see people coming in on I see women coming in on massive doses of things, trenbolone and testosterone and masteron and
Crazy.
all this kind of stuff. And then I also see, I had one lady come in on Anadrol the other day.
Oh my God! Holy
and then there's the DNP is coming back. I've seen that a couple times.
I can't believe people are still using that stuff. I mean,
that and Cytodrin things. I mean, there's some of these really toxic drugs that are coming out of nowhere. And then there's the whole sham of the peptides out there.
Yeah, I'm glad you said that. I'm glad I didn't say it. I'm glad you said it.
Yeah, I mean, I got people coming in saying they're getting this peptide from, it's a real compounding pharmacy, like tailor-made compounding. It's like all fake stuff. It's really, it's dead denatured protein by the time it gets to you. And if they suggest that BPC something or other 192 or whatever it is has some kind of a healing effect, it's a placebo effect, because there's no human studies. There's nothing, and there's nothing to suggest that it would heal your rotator cuff.
It's funny. The most healing peptide that we know of is growth hormone in essence, and people are like saying this is better than growth hormone. I'm like, probably not. Probably not.
In the N of one, everything works.
Yeah, exactly. What I did want to talk to you about more so than anything else is health screening in bodybuilders. And I'm for mandated health screening, at least for the IFBB pro athletes. I know it's hard to do it for everyone because it's just there's so many people competing nowadays as opposed to the past. But I think for the IFBB athletes, I think it's very important. And I don't know why. And I'm hoping that, I've talked to Jim Mannion actually earlier today, and he's, discussing it with his, doctors that he deals with. And I'm sure you're going to be involved in that process because you're very tight with Jim Mannion, obviously. What needs to be done to institute health screening? Because I believe, this is my belief, and I want to hear what you have to say. My belief is that if you force people to get health screening, I'm not talking about like massive amount of tests. I'm talking about a cardiac CT scan, an echocardiogram, blood pressure checks, fasting blood sugars, hemoglobin A1Cs, kidney function. If people can pass these tests and be in a normal, acceptable range, then they're going to be much healthier. And what it does is it puts a speed block in what they're doing, because bodybuilders like to go 100 miles an hour all the time. They like to take gears. A lot of guys don't go off. They stay on cycle all year round, and we know that's not good. You got to give your body time to cycle off stuff, to detoxify itself, et cetera, et cetera. And I feel that by doing a yearly screening on all these IFBB pros, you're going to force them to come off the gear, clean out, pass the screening, and at least make them aware of what's going on. If someone has the 30% blockage in their coronary arteries, not a big deal in the sense that they're not going to drop dead of a heart attack, but at least now they know they got a 30% blockage, and they can actually start doing something to try to start reversing that or not allowing it to move forward. Likewise, if they have a 90% blockage, they can go get stented or whatever the case may be to fix this without going on stage and having a heart attack, 2 days before a bodybuilding show. So I think at this point, we know that steroid testing is not going to be the answer because anyone can beat that test. But health screening, to me, is the solution. What do you think?
Well, first we have to find where problems lie. So we're talking about all these deaths that are occurring. Like I said earlier, nothing is directly correlated to. We don't know the diagnoses, first of all, and they're not dying on stage. George dying before he gets there. If you let's just say, let's play devil's advocate here. If you institute a testing requirement of some kind, even if it's going to have to be randomly throughout the year and whenever, just to maybe get your card or something like that. And then when you do that, then how does that affect when you get on stage? It doesn't.
Well, it does, because you know why, Victor? Because if you have something like a long-term health effect that could potentially be a time bomb waiting to explode, you know about it. If you're running a creatinine of 2.5 and you don't even know it, and your kidneys are slowly but surely failing, this is going to make you aware of it, and it's going to say, "Hey, you better reverse this, or we're not going to give you your pro card."
It's this conversation that makes us aware of it. These kinds of conversations, and keep doing them, that makes you aware of it, because it's going to go right back down to the whole "my body, my choice" kind of thing when it comes to you're getting vaccines or whether you're getting tests or you're doing this and that. You could not care about how healthy you are.
But a
but if you
vaccine
look
is not.
unhealthy,
A vaccine is preventing something from happening in the future potentially. This is something that we're diagnosing now that's going on right now.
for the future.
The problem is that it makes complete logical sense what we're saying, that every bodybuilder should want to be health screened, right? But they won't, because unless you give them the kick in the ass to do it and make them do it, they won't go get screened. Okay, 50% will, 50% won't. You know that.
Well, I think you underestimate the desire to be healthy in the competitors. Now, there's a whole different
Theoretically
group of
wanting to
people.
be healthy and actually physically going out and getting the test are two different things, Victor. You know that.
So I think in competitors' world, I think people want to do it safely.
Yeah.
They just don't know when they're doing it unsafely at times.
Yeah.
And it's really the people that are kind of on the fringe that are kind of just doing it for physique enhancement, recreationally, and or early bodybuilders who really don't know what's going on yet, and what kind of, they do their first cycle and they're on stage and like, whoa, this is great, and then they go to the next thing, they start blasting for the next show. And that's when they see the problems, or wherever they learn that there's something going on. Like, I have a girl who did one show, starts doing stuff, and all of a sudden she's losing her hair, she's getting acne, she's getting a deep throat, all this stuff that, from this bulking cycle on Anadrol,
Right.
And elevated liver function tests and polycythemia, that she knew something was going on with her. She didn't feel good. She was fatigued. She started not being able to lose weight despite the DNP.
Oh my God.
And then they want to get labs to find out what's going on, or they have a coach who told them to come to me. In that particular case, this was a coach who took on this person after another coach was doing this to her, and said, "You need to go see Prisk before I work with you."
Smart.
And so having the awareness at the levels of everybody involved in the sport, whether it be from the organization, from the trainers and the coaches, and the athletes themselves taking responsibility for their health. I don't think that we can mandate our way to healthy bodybuilders.
Victor,
I think
I'd love my son to listen to me and not be dangerous when he goes out by my driveway. But if I don't keep an eye on him and my wife doesn't grab his arm and pull him back, he's gonna run in the middle of the street and get hit by a car, because he's not
an adult.
But you know what? Unfortunately, a lot of these bodybuilders out there, and myself included, when I was back just starting out, are emotionally not necessarily aware of what's going on, or they just don't want to know the reality of what's going on. So you have to make rules, because if you don't make these rules, they will not adhere to them, and they will not worry about their health. They'll worry about how big their biceps and quads are, and they're not going to worry about do I really want to go to the doctor and have them tell me that I have to go off cycle? Or do I have to actually go off cycle to pass this health physical? I don't want to do it. I'm not going to do it. And because I don't want to fall behind these other guys. It's the stupidest mentality. You and I know this, because coming off and then going back on is actually helps you grow better, because you reset your receptors, and we know all the good stuff that goes along with that.
Well, so we know all that kind of things, and we know that
we can tell these guys that, but they don't listen. They don't listen.
Well, the same thing happens when you create Obamacare and say you have to have this mandate of getting your insurance and paying for stuff when you're not unhealthy. It's you're going to get down to that same debate, and that didn't pass in the Supreme Court very well, did it? No. So I think what we have
there's no debate. This is a private organization that can say, hey, you know what? We care about our athletes. We're going to give you some basic stuff. You got to get checked out. And if you don't get it checked out, you don't get cleared, you don't compete. That's it. In football, you got to pass a physical in the beginning of the season. If you don't play, right?
Yeah, everybody in organizations around bodybuilding was a bodybuilder or understands the athlete. They all know a little bit about what things are unhealthy and what's healthier. Everybody knows that it's unhealthy to use diuretics to get on stage. It's just it's known in the industry that it's bad, but people are doing ridiculous diuretic cycles like at the end, like they're doing it for 2 weeks at a time. And a girl taking 100 milligrams of Lasix before they go on stage, and it's always to make up for the fact that they're not in shape.
Yes, absolutely.
It always is. And so you're taking a person who's not in shape, probably unhealthy because they've been for the last 3 weeks crash dieting,
Right.
and they're taking all of the thermogenics they possibly can, whether it's thyroid and clenbuterol, which is revving up your heart, and you got, caffeinated things, whatever. You're just putting yourself into you dehydrate with all of that at the same time. You're going to end up with an arrhythmia. You're going to end up with renal failure because your heart isn't pumping right. I mean, it's something where you get the word out that people know what they need to watch out for and what's stupid. Like using diuretics is stupid. Just letting everybody know. Okay. My worst shape on stage was when I decided to try one once. I was crampy. I was flat, but you knew me. We worked together a little bit for a while there. And it was that low carb diet, man, killed it every time. I had striated glutes at 6 weeks out.
Yeah.
If I didn't think I was going to be ready.
Right.
Because I wanted to be able to eat into the show. I wanted to be able to have some water on stage. Here's a good story for you. I was doing my pro show in 2016, and I was on stage, and I did in the prejudging. I come off, and I have sweat running down me because I started sweating on stage. There was a coach from the area who says to me, right out, says, "Yeah, if you were dehydrated enough, you wouldn't be sweating on stage."
As if you have no moisture in your body when
you need to be dehydrated to compete. You don't. What is muscle filled with? Water.
Yeah.
How do you have big muscles without water in your body? I don't understand. It's you got to have the right electrolytes to be able to stay up there and be in shape. And if you're shredded to begin with, and I always was on stage, I made sure of it.
Well, you were in shape, and that's why you were hard and dry. I mean, and then a lot, like you said, a lot of guys compensate with lack
my
of
skin
conditioning.
was thin.
Yeah.
And I ate into it, Yeah. And so you're full.
What I don't understand, Victor, is we talk about this diuretic situation. Now that you brought up diuretics, and we see that there's been some deaths from diuretics. Okay, and we know the protocol. I'm not mentioning names. I don't need to mention names, but we know who's out there. And these coaches that are prescribing these prolonged diuretic protocols.
Are they doctors?
All right. Well, they're giving the protocols on the fucking email they sent to the people. Why are they continuing to do this? That's what I don't understand. After we talk about it ad infinitum, you think they would modify their protocols? And some of these coaches are good coaches. They get people in shape. They don't even need to do these crazy diuretic protocols. I don't understand.
It's ingrained that they think they have to do it because they've been doing it for so long that something will go wrong if they don't. I'm right with you on that, man.
It's insane. If you can't get dry from one day of diuretics, then you're doing something wrong,
Right. You're right on there. Yeah. It's crazy.
But yeah, I agree. Diuretics can be dangerous, but I blame the competitors for listening to crazy coaches at this point. By now, we've gotten the word out there that if it sounds insane and they got you doing diuretics for more than a day or so, you're probably going to get yourself in trouble. But the thing that bothers me is when I see a guy like George Peterson, who's one of the nicest guys. I mean, such a good guy, passionate about the sport. I mean.
Always the most friendly guy.
There's not a nicer guy out there. No one has a bad word to say about this guy. And he dies in his hotel room alone, laying in bed because God knows what happened. The autopsies take forever to come out. The autopsy's not been released yet. But that bothers me. And I feel like maybe this could have been prevented if we would have screened this guy, if he would have had all that testing done. Maybe. And I don't even know what the cause of death was yet.
Yeah, I mean, if it was related to, whatever it is that he did to try to make weight, or if there's, if it was a crash dieting that just caught up with him, or if he was polycythemic and didn't know it and got dehydrated.
Right.
Any number of things that he did. I heard something about an aneurysm history in the family or something. Yeah. I mean, whatever it was that tipped it over that caused him to die. There's extremes in anything that, that you do that are bad. I mean, if you drink too much water, it could kill you. Yeah. So I see people drink 5 gallons a day a week before the show, thinking they're going to, I don't know what they think they're doing with that. But. So I think we need to make it aware to people that, they have methods of being able to know, well, I'm too dehydrated. My urine is getting brown. Yeah. I'm not being, I'm getting palpitations. My heart is racing. I've been tachycardic for 3 days in a row. Right. You go to stand up and you're lightheaded. You check your blood pressure if it's either too high or too low. I mean, if you're watching things and measuring things, and in my old game plan book, I always say graded exercise, attitude, integrated medicine, nutrition. That graded part was not just grading up your exercise, but grading yourself regularly with tests, whether it be you're checking your resting heart rate, you're checking your heart rate variability, you're looking at your blood pressure, you're looking at your labs. And if you need to, you go to see a doctor and you get those tests done. I think that not everybody has to have the test done, but if you're taking it to another level, everybody who's doing that, I mean, from a coach's perspective, you should think this too, right? Like if you're telling your clients, you know what, you're doing some things, you need to get some tests done.
Right.
You're smart to do that because there could be some liability on you if something happens. Right. Like you said, some of these people are prescribing things. Could there be some liability if you told them to take, not you, but if somebody told them to take a diuretic to get on stage and there's a bunch of emails of you saying, here, you got to take 100 milligrams of this and 100 milligrams of that, and you die? Are you an accessory to that murder, like manslaughter or something like that? You have to be, as a coach, aware of people not looking healthy, not feeling good. You should be asking them those questions. How's your heart rate doing? I mean, see, that's the problem. We need awareness.
Victor, with Apple Watches today and all these Fitbits and stuff like that, you can know your heart rate, you can know your blood pressure, you can know your oxygen saturation. I mean, it's really amazing the technology we have today, just with a little watch on your wrist, and an iPad and an iPhone.
There's all sorts of home ways to. I mean, we have all sorts of medical devices that we use to monitor people from home. The whole COVID crisis kind of led to this need for virtual monitoring of people.
Sure.
So there's been an exponential increase in the number of things to do that, to allow doctors to be able to assess people from their homes. So
moving forward,
it could be expensive. Be expensive too. So it's like, who's doing it? But you got to find the things, teach them. I can check my own heart rate.
Right. I'm saying you don't even need to put your fingers here anymore. You got a watch on your wrist that'll tell you what your heart rate is. You actually have a watch that will tell you what I mean, how much easier can we make than that? Pretty soon that watch will tell you what your blood sugar is probably too. It's incredible, the technology we have today and the diagnostic tests that we have available, for people. I can't tell you how good I felt when I was dreading getting my colonoscopy, my first colonoscopy. You're supposed to get it at 50. I think I got mine at 51. I was putting it off, and I
changed to 45.
Yeah. Or whatever. I didn't have a history of any kind of colon cancer in my family. But I went and got that colonoscopy, and I felt so good that I had complete clearance, and the doctor says, you're good, man. I don't need to see you for 5 years. Same thing with cardiac CT. When I went for cardiac CT and I had 0 blockages or 0 calcium, I mean, I felt like, you know what, I did something right. And now I felt like, okay, next time I have a little bit of a chest pain, I'm going to know it's indigestion. It's not that I have a blockage in my coronary. I knew now what was going on in my body. And bodybuilders should want that too, because we do risky things that could cause problems. And if you know what's going on in your body, you can rule out, I don't have a blockage. I know that. Okay. All right. So I'm not going to worry about that. I was having indigestion problems. I don't know. I don't know what was going on. I had a CT of my chest and abdomen because I'm 53 in my family. There's a very big incidence of cancer. And just to know that I had nothing on my liver or my pancreas or in my, upper GI, it made me feel good. I felt like, all right, you know what? Now I know I'm clear.
My motto in my commercials is even when in doubt, check it out.
Absolutely.
If there's any thought, you're having some chest pain, you don't know if it's related to reflux, you're feeling fatigue. Even just a little bit of fatigue can be a sign of cardiovascular disease or heart failure or, ischemic heart. So, you throw in diabetes and some neuropathy too, then you can't feel any of that stuff. So if there's any doubt, check it out. I think that we need to know is in the bodybuilding community that, it's not even just the act of bulking and cutting is all potentially damaging to our blood vessels in itself, just from the massive amounts of food, added calories. Even if you're eating rice and couscous or quinoa or whatever, you're but still getting elevations in your blood glucose when you're eating that much starch.
Sure.
And things are coming up and down, and you're burning out the pancreas a little bit. You start throwing in some gear, and you have further problems that put you at higher risk for heart disease. There was a book called Running to Death. That there was a marathon runner who, if he was running like 100 miles, but he died from heart failure. And it was kind of similar to an athletic heart, but a different story. So the whole point is, if you're doing anything in excess, you got to get checked out. Anything that involves your health.
It's like a race car. You got to check the race car engine out, right, to make sure it's performing at maximum potential. Because when you're running it at those heat, at that speed, and it's revving that hot, things go wrong sometimes, right?
Especially when you keep adding additives and you keep adding,
exactly.
You start putting some nitrous in there, and you start burning up your gaskets, man.
Yeah.
So, yeah, I think we need to have a little bit of a discussion that sticks with everybody who's in the know, and the people who aren't in the know, we need to recognize those people and get them in the know or get them out. And I think it's on the responsibility of the bodybuilder to do that. When you're doing illegal substances and you're using things that aren't necessarily prescribed for you, no regulating body of any organization can mandate anything about that and avoid it. I mean, these people are going to do it. And so we have to assume that everybody's doing it with unhealthy, and just let everybody know what they need to do to be healthy if they're going to do it. Yeah. That's what I try to do with my patients. If they come in saying they're taking gear, I don't stop them and say, you know what, you just have to quit everything unless I see something really bad going on. And I'll be like, hey, you can do your own thing. I'm going to help you be safe about it, but I'm not going to condone it. I'm not going to say, hey, take more of this or that. I'm going to basically say, okay, if you're going to do it and I can't stop you from doing it, at least I'm going to be there to help you do it safely, and just keep a check on things.
Before I let you go, gymnastics or bodybuilding, which one did you like better?
Every day of my life since gymnastics, I think of routines in my head. Like, it was such a part of the visualization process that if I'm sitting here kind of just, I'll be twiddling my thumbs. I'm doing the pommel horse now, I'm doing the high bar. It's instead of twiddling thumbs, man, I do high bar routines. It's gymnastics has a really special place in my. You were really
good too. You were very good.
Yeah. So it was. I enjoyed both sports. They both had. I always loved posing on stage and doing some great routines. Yeah. Something I miss a lot. Developed some arthritis in the shoulders.
You're going to be like me. You made fun of my shoulders for years. Now you get to be the next guy getting the shoulder replacements.
I'm there, Dave. I'm there. I'm definitely there.
Call up Dr. Frankel in Tampa. He'll take care of you.
Yeah.
Victor, I love you, man. Thank you for stopping by and helping us out with talking about health and well-being. And if people want to go to your clinic and talk to you, what's the best way to get in touch with you?
You can go to orthoandwellness.com. You could call my office if you like, 412-525-7692. I'm glad to help out. We do virtual visits. I have a nurse practitioner who's here when I'm not here. So if you need me, I'm here. I'm here for everybody. I love you too, Dave.
Yeah. And Victor's really great because he really understands the bodybuilder. He's not going to give you this. He might give you the speech, but he's certainly not going to condemn you for what you're doing. All right. Thank you, Victor, so much. And that's going to take us
to Amanda and your beautiful wife and your beautiful children.
Thank you.
I love watching your family grow. It's awesome, man.
You got to come out here one of these days and see my family.
I will, especially when that snow starts coming down. I'll be there.
We got a sanctuary here. All right, we're going to wrap this up. Dave Palumbo with another installment of RXMuscle's Supplement and Science. Thank you, Dr. Prisk. We'll see you next time.